Okay. Hello, everybody. Do you come on in and join us? Welcome, welcome. Good morning, Ben.
Good morning. How are you?
How are you? I'm good, thank you. How are you?
I'm doing well.
Great. What time is it with you? It's midday here in the UK.
It's 4 a.m. Pretty
4
early.
a.m.
Yeah,
Really?
yeah.
Oh my goodness, that is devotion. Welcome, everybody. Please do let us know where you are joining from in the chat. David Bolton, good morning, good afternoon to you. Great to have you here. Thanks for joining us. It's great for Ben and I to see where people are coming in from. Good morning, Marie from London. Welcome. Yasmin from Switzerland. Welcome. Maria from Surrey. Eddie from Orlando, Florida. Cecilia from Utrecht. Selena from Brisbane. Louise, oh my goodness, it's going too fast now. Julie from the Gold Coast. Louise from Scotland. Bill from Scotland. Amazing. Thank you so much for joining us live today. Thank you for signing up. Okay, right. We're just going to kick off because I think there's going to be loads to learn from Ben today. We're super excited about this clinical discussion. It's the first one about bodily relearning. I'll kick off. I have a little introduction so you don't miss anything. And then Ben will get started with the session. Okay, here we go. Hello and a very warm welcome to this NOI Group Clinical Discussion. My name is Joanna and I am Director of NOI Group Europe. And I'm joined this morning by the utterly brilliant Ben Boyd. Morning, Ben.
Hello there. Thanks for having me.
Great to have you. Ben has been teaching NOI courses on peripheral nervous system anatomy, biomechanics, clinical evaluation, and intervention since 2004. And he's been with the NOI Group US teaching facility since 2013. God, that was a mouthful. Ben is an active clinician himself, specializing in persistent pain conditions at Stanford Healthcare in California, where he works with individual clients and group classes. He is also author of one of our newest publications, Bodily Relearning. Ben, would you be able to tell us a little bit about the book, about the new book that's come out?
Sure. Yeah, and just thanks again for having me. Happy to talk about the book, Bodily Relearning as a project. The book was the main first objective with that, and then into the course and other projects. The book was intended to outline a rehabilitation approach designed to help us find ways to reset our system when our bodily protection responses seem out of balance, which is very common with persistent pain. Um, it offers strategies to help restore this balance and help reteach how our body reacts to activity. So trying to help decrease sensitivity and protection and allow more freedom of activity. And I guess the last thing I would say is that we really aimed to build intuitive, engaging clinical resources with it to help us as healthcare providers or movement specialists to really engage with those that we work with that are dealing with persistent pain.
Yeah, it is an amazing book, isn't it? We've had absolutely incredible feedback about it. It's very exciting. I felt like it was definitely next generation in the NOI suite of publications. Really great book. I should have a copy actually. Have you got one handy?
So,
I do feel
somewhere,
like I need
yeah,
to show it. Hang on, let's just get one.
yeah.
Here we go. Let's get one.
While doing that, I get to see where everyone's zooming in
Can
from.
we see this? It is so, oh, I've got my screen on, so it won't show up very well. Put it on there. That's it. There we go. Bodily Relearning. It's a fabulous book. It's a really big book with absolutely tons of pictures and absolutely fantastic. Anyway, right, I do love it. Okay, so moving on to today's session. These webinars are all about giving you a taste of bodily relearning and how to practically use it in the clinic. Now, some of you may have already done one of Ben's courses, and for those of you who have, this should act as a to reinforce what you've already learned and maybe even go into some different aspects of it. But for those of you who are new to bodily relearning, this will give you a taste of what is covered on Ben's course and in the book. So Ben has got a course coming up in the UK. It's in Oxford in September on the 13th and 14th. And we will come back and talk to you a little bit about that at the end of the webinar. So if anybody is interested in attending the course, then we'll give you an overview of what to expect. But for now, the webinar today, Ben is going to be talking for about 20 to 25 minutes. If you have any questions, please put them in the Q&A or in the chat. I'll monitor that and we'll get to as many of them as we can. I would urge you to get your questions in earlier rather than later, because we often run out of time. So if you want your question answered live by Ben, then please do log it as it comes into your head. If you want to watch the recording of this session, it will be uploaded to the NOI Group Clinical Discussion YouTube channel, and I'll drop the link to that in the chat in just a minute. So today we're going to be talking about predictive processing and movement exploration. So Ben, could I ask you to start by explaining what predictive processing is and why it's so relevant to how we experience movement and pain?
Sure, thanks, Joe. Predictive processing is at least a component of how our body makes sense of the world and how we can act within that world, but in a proactive and predictive manner. It involves us kind of modeling elements of ourselves, our environment, both socially and physical aspects of our environment, and how we can engage with those elements of the world, given those internal models. It describes a proactive kind of sense making of ourselves and the world. The theories that predictive processing kind of is built upon has some mathematical underpinnings, many of which are above my head, and they relate to how we make kind of active inferences or predictions and evaluate, then comparing that to any feedback we might receive from engaging with the world. And partly the idea is that any discrepancies between our predictions and that feedback, which have been described as, expectation violations or prediction errors, that those discrepancies or differences can help guide us to adapt and update our internal models. And with one of the, I guess, ultimate goals of that as an organism is to preserve energy and to minimize that error, try to get our predictions pretty in line with what then we experience and occurs. And when it comes to safety and determining what's safe to engage with and what's unsafe or risky or threatening, then to try to minimize that error for the purpose of survival.
Okay. And so in terms of the pain experience and movement, are there sort of specifically, why is it so relevant to the pain experience then?
Because it's something that our body is trying its best, putting a lot of energy into to make sure we are accurately predicting what will be threatening to us as a species or as an individual. And so pain can be a part of that experience of anticipated, predicted, threatening, or unsafe activities. And that definitely influences how we choose to move or maybe even shut down movement within our lives and how we engage or disengage from being active in the world.
Brilliant.
Yeah.
Oh, that's great. Thank you. That makes lots of sense. So how do previous experiences and expectations influence the way our bodies respond to movement, especially when you're dealing with persistent pain?
Yeah, if we think about how our body comes to make those predictions, or creates those internal models, they're heavily influenced by past experience, um, past past healthcare experiences, past experiences with activity that was uh, injurious, painful, problematic in some way, both for our own past experiences as well as those we've had the opportunity to observe with others.
Mm.
And that calculus, all those that processing of our predictions takes into account really any seemingly relevant information, including past experience. So those internal resources that our body can draw upon includes our memories of past experiences. It also includes evaluating the situation of the present moment or predicted upcoming moments. Importantly, I think it's we can frame it as our body is not just reacting to the circumstances of the present moment, but we're actually predicting them based on
Mm.
past experiences. So it really our past movement experiences, our past healthcare experiences play heavy here.
Mm. Did you say that it can be others' experiences as well as your own?
Oh, absolutely. Yeah. Whether that be people we've actually met or real people or people that are created in the TV, movie, video game space as well. People past, present,
Wow.
and predicted to be part of our future. Absolutely. Yeah.
It, a slight aside question, but is that something that people are generally aware of, that they are influenced by that sort of broader?
I think so to some degree. If you're talking about the experience of maybe your siblings or others at school when you're growing up, pretty
Mm.
tuned into what others around you might experience. But I think there's different levels of, true understanding and empathy with that. But I'd say it's very influential. Our awareness of it can fluctuate or be
Mm.
heightened for sure. If it was a family member or a close friend, then it might be very impactful. Yeah.
Amazing. We've got a question here. I can't actually see who it's from, but that's absolutely fine. And I will ask it now because it's appropriate in the flow. So, why do people have different pain responses at the same level of activity, even with the same repetitions and loads?
Mhm. Yeah, I guess there's two parts of that question that could be what you're asking. Why do people have different pain experiences at the same theoretical engagement with activity? Are we talking about different people? Or are we talking about the same person having a different response that might be less predictable? Sometimes they could do it and sometimes they can't without pain or with pain. So two aspects of that I can try to answer. Um, Context. The trying to understand the context biopsychosocially and beyond of that given moment or what their body is predicting is relevant to pay attention to in that moment could sometimes be the difference between um, how their system responds to that present moment. So if we're talking about the same person over time, some days I can vacuum and sometimes I can't. We need to look at the other elements of what's going on in that particular uh, part of their life and how that is changing their predictions based on their internal models. Now, if it's between different people, then even more so the differences in past experiences, how their model has been created, as well
Mm.
as then those contexts of the moment. It's a
Great.
difficult one to answer, but I think that's where I tend to look for answers. Yeah.
Yeah, that's great. Thanks, Ben. So
Mhm.
I'll just take one more question from the chat here before we move on with our flow. And Jenny Lewis asked, great question, Jenny, thank you. Could you explain how bodily relearning differs from pain reprocessing therapy with movement, please?
Yeah, if you're talking about pain reprocessing therapy, um, there's a lot of similarities with many other approaches. Bodily relearning is uh, both, I would say, top down and bottom up, in terms of there's a cognitive piece, a conscious element of what we're exploring in sense making, what's going on, what can we do about it, as well as kind of a guided approach for how do we engage in movement that can help reteach our system from the bottom up through experiential learning. And I think reflection really ties into uh, both elements, or pulls those both elements together. And in addition, we often use things like mindfulness practices to try to help uh, reteach, hence the relearning, our system when it seems out of balance with what we would expect when we rationalize what we would hope for in a particular moment, and that's not what we're getting. If we're getting extreme levels of bodily protection or discomfort, how do we reteach that system? So we might use mindfulness practices to help self-soothe and calm, as well as looking at physical stress management and load management at the same time for that same agenda. So I'll allow others to compare that to other frameworks that are out there, knowing that there's a lot of similarity. This was a way for me to make sense of my approach and put it out there as potential resource for others to think through their clinical practice. So I won't speak to, well, here's other systems, but you can compare then to others that you know about because there are many.
Mhm. Okay, thanks, Ben. That's great. So we're just going to plug back into the flow here, and I'll come back and answer some more of the questions in just a moment. So, Ben, what's the difference between conscious and non-conscious elements of predictive processing, and how do both impact movement patterns?
I think when I listen to experts in the predictive processing world, and see it get translated into social media and, I guess, lay terminology. Sometimes the assumption is that all of this is a conscious process. And I see this very much as actually when it comes to our self protection, or how our body determines how safe am I, how safe would it be for me to do something, movement, activity. Much of that calculus, I think, is actually non-conscious. A lot of that processing, we're really only aware of, we become aware of very small components of that, a portion of what our body is doing behind the scenes. Um, our bodily protection responses, including a pain experience, I think are driven primarily by non-conscious processes. Um, and yeah, it can be very impactful in um, our both determining what our body sees as safe and unsafe. But even that language of, look, this is mostly a non-conscious process, that we could think of our body bringing in our conscious attention when it sees that as beneficial, as a really powerful resource to help deal with the situation. Sometimes that's very de-threatening too, as an understanding of what's going on. It takes away a lot of blame. It takes away a lot of, well, this was in your brain. This was your brain deciding. This was you deciding. This was made up. This was your choice, or you were consulted on this as a conscious being.
Mm,
And I'm not sure that's always the case.
Okay, I've got to ask a little.
Yeah, please.
So you did the question I've got here is, so if you're talking about this with a patient, how do you approach that, the sort of unconscious beliefs?
pretty matter of fact. One choice is to use selective language that actually speaks to this being more than a process of just our brain, and using the terminology body over brain, um, to speak to this, not only, I think, accurately that this is beyond our brain, but also to try to avoid the idea that this is just in your head, that this is made up or not real. That sometimes that brain-centric language can come across that way.
Mm.
But then also, when we're talking about the body doing this, be really explicit that, a lot of this is happening so fast for the purpose of safety and keeping us away from unsafe things, that your body's not going to wait for you to think everything through at a
Mm.
conscious level. It's doing a lot of these processes behind the scenes for the purpose of doing this, evaluating a lot of information and reacting quite quickly. And that
Mm.
makes sense. So just fairly matter of fact, but also then that selective language of maybe de-threatening it from the idea that this is just in their head
What was
and
the
their
phrase you
fault.
used? Body over brain.
Yeah, just body-centric language as opposed
Yeah,
to brain-centric language. We could say
yeah,
your body is doing this, and that includes processes within your brain, but it's not wholly housed within your brain.
yeah. I actually love that. I've seen or heard you say that before, I think, body over brain. It's a much less threatening and intimidating concept for people to get, I think. It's more together rather than, brain focused. Yeah, great, thank you. Okay, so could you share some practical examples of how movement exploration can help update our body's predictive mechanisms, please?
Yeah, I'll use an example. So if I predict that gardening is going to be pain-free, no problem for me, but it ends up hurting in some way, my body will evaluate that prediction error, that discrepancy, and consider whether it should update my model of, is gardening safe or potentially painful. Now, one time of having a little bit of pain with gardening might not be enough to completely remodel my internal conception of gardening, but I might be on higher alert the next time I go in to do my gardening. And if pain is consistent with gardening, then I probably would update my model to include, well, gardening always hurts, or gardening mostly hurts, or is very likely to hurt. And that could be my framework. I might even stop engaging with gardening if it hurts sufficiently to interrupt my day. And that's my prediction that it would always do that. Now, the reverse could be true too. If I'm experiencing pain-free activity when I've had predicted that it would be painful, that can do the updating as well, or
Mm.
promote updating within our internal models of revising what I see as safe to engage with in terms of movement or activity.
Interesting. Thank you. I've got another little question there. So when people
Mhm.
update their internal models, um, how long does it take for somebody to sort of update that internal model? Is it completely variable dependent on the person?
I think it's variable, but it can happen, I think, within milliseconds. I think if I
Well,
expected a movement to be tremendously painful and I was able to or willing to engage and do that movement, and it was the complete opposite of what I expected, I think our body is already instantly evaluating that situation and non-consciously and consciously determining should we update. And it can happen very quickly, particularly when there's a large expectation violation. I predicted it would be very painful and there was no pain, compared to probably less likely to do it that fast if I predicted there would be a lot of pain and there was close to that level, but slightly less or slightly more. So the
well,
magnitude of difference could influence how quickly we're going to adapt. but I think this is a real-time millisecond to millisecond. Really, I would say this is a process, not a thing. An internal model is just a metaphor. It's really that we are constantly internally modeling.
Thanks. Quite powerful. Like the instantaneousness of that is really powerful, isn't it? That's what strikes me. Yeah. Wow. Thank you. Okay, so we're just going to come on to a little bit more practical application now, guys. So, for clinicians working with patients with persistent experiencing pain, um, could you suggest some key strategies to help patients engage with movement in ways that positively influence their predictive processing?
Sure. Yeah, I'll highlight just a few that I've already mentioned just to pull it for this concept. How we use language influences how we make sense of the world and how to move within it. So our body doing something at a non-conscious level compared to our brain is consciously deciding to create this pain or this protection are very different understandings that actually change how we understand what's safe and what isn't, and how things work and what we can do about it. I'll come back to the idea of maybe sometimes when we engage with movement and there is discomfort, we need some narrative for, well, why wouldn't we just shut down? And so, practically speaking, we can help people understand that, well, not all pains are matching exactly what's going on in the tissues, that there can be a disconnect there or things that modulate that relationship, and understanding what it is that modulates that and what can amplify that are important factors that can help us understand, well, maybe I do need to evaluate what it is I'm feeling, what is the body feedback, and then decide, should I continue or should I shut down or modify. Mindfulness practices can be really helpful in that regard, which I mentioned before, to help self-soothe the system that's going on high alert as we engage in activity. If we understand that activity to be safe, but our body is highly protective of us engaging in it. And then whenever possible, create those expectation violations where I anticipated that this would be painful, but it ended up not being, because those are real eye-opening experiences to help us re remodel what we understand to be safe and potentially pain-free. Yeah, safe to engage with.
Thank you. That's sort of pulled through together some of the threads that you've been talking about earlier. So we're just going to come to the questions now, and then we'll sort of do a few key takeaways from Ben, and then we'll move on to talk about his upcoming course. So from Felicity Hutton, how does this bodily relearning approach differ from cognitive functional therapy by Peter O'Sullivan?
Yeah, I guess I would say the same answer as I said before for cognitive reprocessing programming. Sorry, I said that wrong.
Pain reprocessing therapy.
uh, I would say this, there are a lot of similarities. We're speaking to a predictive machine, our body, and both are speaking to those aspects of it. My attempt here was to pull together, how do we engage in seeking understanding, uh, seeking insight into what's going on and what we can do about it, and then actually to guide people through how we go about exploring movements. Uh, as a physical therapist, maybe add in physical load management as well as mindfulness practices sprinkled in there to help restore, reset that system. So I think others, Peter O'Sullivan and so forth, are speaking to similar themes. They just have a slightly different package in how they express that. Bodily relearning is uh, along those same lines in my attempt to create kind of extensive clinical resources that are intuitive and engaging both visually and conceptually and metaphorically, that my clients over the years of me trialing this have really gravitated towards and helped me learn what was a useful package. So again, I'll let you compare to other systems or other approaches that are out there. There's far more than I could cover in this session, but Peter O'Sullivan's approach being one that's, I think, very in line with this, but might speak to it in just slightly different language or a slightly different approach.
Yeah, thanks, Ben. And we have a sort of a practical client, patient example here from Eugenie, who I think's had to leave, but she said she has a client who experiences severe pain in her left leg one day and then the other leg the next day. The pain shifts daily, and she's even started planning her activities around it. What would be a good way to help to break this pattern using your bodily relearning model?
I think first would be kind of framing why is it jumping around and understanding that that's a very common sign of a body on high alert or a highly sensitized system. And just understanding that while we want to track that uh, kind of drift of where those symptoms are within the body, it doesn't necessarily change our approach and how we engage in activity, and that wouldn't be chasing necessarily, well, where is it in this particular moment? That as long as we're confident that truly this is a sensitized system and not something new going on, we need to do our due diligence to evaluate that situation. But when we are confident this really does match a sensitized system, putting into action the strategies that I mentioned to how do we engage with reteaching and helping that system relearn a new habit mode for how it responds to activity. It's not uncommon for people to have symptoms that jump around. It's as if the body is starting to pull alarm bells and all over the place, getting very creative in how to draw your attention to what it's predicting as threatening. And that's what we're trying to help it restore some balance to.
Thank you. Thanks, Ben. That's great. Thank you. And next question is from Susanna Griever. How might less obvious, no vertigo nor dizziness, I can never pronounce that word, vestibular issues or primal reflexes, retained or returned, come into play with this? Does that make sense to you? It's in the chat, Ben. It's Susanna Griever.
Where'd it go? I lost it when somebody else added in.
Yeah, I know. It jumps, doesn't it?
Oh, I see it. Here we go.
Yeah.
In our, I'll try to answer this as briefly as possible. In our group classes, we have people with both persistent pain and persistent dizziness. And we see a lot of overlap in how the body is responding to this distressing experience. Some of the folks have then that cluster of a body on high alert with persistent pain or persistent dizziness, or sometimes both, or anxiety or fatigue, you name it. I see this as, you mentioned it as less obvious. Sometimes it's very obvious that that's the dominant, distressing sensory experience that they have. I think the bodily relearning approach is not just about pain. It's often applied to persistent pain, but it's really more about when the body's protection responses, of which could include pain or dizziness, seem out of balance. How do we restore some of that balance? How do we resync it to what we would hope for to help protect us, but allow as much freedom of movement seems safe for us? So I think, I'll end it there. I think it still applies there to when those are the ways the body presents that it is on high alert and highly sensitized.
Thanks, Ben. And from Maria, how do you update the model if it always hurts doing something?
Mm-hmm. Yeah, I think that's where a big challenge with traditional kind of mapping out of predictive processing applied to movement comes in. It's often recommended, and this is one of Peter O'Sullivan's gifts and strengths, is the recommendation to seek out those expectation violations as a learning opportunity to help reset that model or to reteach. But we don't always have the opportunity when everything hurts. And we need a different narrative when everything hurts, that we have to evaluate what is the message from the body when it does hurt as best we can. And this is very challenging. Figure out, is this the body telling us, be careful as you do something? And it's not asking you to stop. It's just asking you to be attentive and aware and cautious and kind and gentle. Or is this the body saying, be careful, don't do this? So that subtle difference of be careful as you do it, is that the message? Or be careful, don't do it, is really what we're trying to figure out when everything hurts, because we don't want to, it's not productive to suggest we'll avoid pain, stay away from pain, because that just, well, then people would not be doing anything. So finding that balance, which is very tricky and individual, one-on-one with them to try to figure that out, is really critical.
Thank you. Thank you, Ben. And we're just going to take one last question here, which is, can bodily relearning help with central sensitization of pain?
Yeah, well, I see central sensitization as a mechanism of how the body is bioplastically adapting to protect us. So yes, I think it is aiming to modify how the body is using that mechanism when it seems to be an out of balance. Both central sensitization and or peripheral sensitization are very relevant for a bodily relearning approach, because that's some of the underlying mechanisms of what we would expect to be going on if we could see it at the cellular and systems level behind that story of this is a sensitized system. So absolutely, I think it would be very relevant there. Now, we don't necessarily have metrics that we can clinically say, here's how much central sensitization you have. We don't have that gold standard, so to speak, but we're doing it through clinical reasoning to understand that that's likely a process that's going on, mechanism we're trying to help change and create bioplasticity within that system.
Brilliant. Thank you. And then there was just a question about some authors that you like the most. Now we're going to put these in the show notes on the YouTube discussion channel. So I've asked Ben for those, and we'll add those to the show notes so you can find them there. So sure. Just to wrap up, for anybody that it might be interested in learning more about bodily relearning with Ben, Ben's just going to tell us a little bit about what to expect if you were to attend one of his courses. We have a full schedule there's online and there's face-to-face courses, and the link to that is in the chat just above. So you can click through there, you can see all of Ben's upcoming courses, some face-to-face, some online. And Ben's just going to tell us a little bit about what you might expect to come away with if you attend one of his courses. Thank you.
Of course, thanks. The face-to-face bodily relearning course is a 2-day interactive course based on the principles of bioplasticity of the human body. And the online versions that's coming, this will be the first year that we do an online version, will be spread over 3 days, just because that amount of time on Zoom can be a little tough. And the focus is on, as I'm recapping here of many things I mentioned, regaining some control of our bodily protection responses, including pain. We do this by kind of multiple main themes: seeking insight and understanding, so that top-down approach, movement exploration and how to guide that for ourselves and for others, physical load management, and a sprinkling of mindfulness practices in there as well. Looking at the biopsychosocial factors that we can influence to help that system come to a more comfortable level of still protecting us, still looking after us, but allowing as much freedom as possible. And the other piece about the course is that we really try to include in that kind of extensive clinical resources, including patient worksheets, interactive activities, teaching slides, movement, and educational videos that you could re-listen to or even use in clinic to really enrich our clinical interactions with people who are experiencing persistent pain and really help them suffer less, engage in life, and thrive more.
Thank you. Thanks, Ben. It is an amazing course and really exciting. It definitely is looking to the future. So thank you for sharing that with us today, Ben. And thank
Pleasure.
you for sharing your expertise with us about bodily relearning today. It's been absolutely fascinating. I've learned loads, and I hope everybody else has too. Thank you for joining us live. And thank you for all your questions and your support. And we love interacting with people around the world. We love these clinical discussions. It means that we can connect with our audience and share some of these really, really exciting things with you. So I hope you find it valuable, and we look forward to seeing you again very soon. So thank you, Ben. Thank you, everybody, for joining. Take care. Enjoy the rest of your day, Ben, from 4 a.m.
Thanks, everybody. Appreciate it. Thank you.
Thanks so much. Take care, everyone.